Thank you, Sahani sir. Good evening, good afternoon, and good morning. This is the 1896th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Shalini. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic doctor, a student, or a lover. The purpose of this forum is to take homeopathy to every home around the world. Let me come to today's guest. Today, our guest is Dr. K.A.SHALINI.
Good morning, Dr. Danesh.
Today, our guest is Dr. K.A.SHALINI. She has completed her BHMS and from Government Homeopathic Medical College, Bangalore, and she has undertook certificate courses in children's health, that is CCG, and certificate course in gynecology and obstetrics, and certificate course in skin and venereal diseases, SVD, from BIMT Pune, Maharashtra. She is the physician at a duty doctor, Homeopathic Charity Center, Bangalore, and she is another physician at Nisarga Homeopathic Clinic, Bangalore, Karnataka, from December 15 onwards. And she has presented so many sessions in this forum. And today, Doctor will be talking about one of the important session, that is that, as you all know, that it is thyroid diseases and its homeopathic management. Nowadays, a lot of thyroid cases are increasing, and there are a lot of cases. Most of the cases were treated by the so-called modern people, but now cases are coming to homeopathic doctors, and we have definitely not only simply management of the treatment, but we have cases where we can successfully treat and cure the patient completely, bring back him to normal, and we can avoid continuous medication. That's the beauty of homeopathy. And so we can proudly invite the guest of the day, Dr. Shalini, to this forum. Yes, Dr. Shalini, you can begin the session.
So thank you so much. Thank you. Good evening, everyone. Today I'm going to present thyroid disorders and its homeopathic treatment. So I'll be sharing the slides. Okay. Is it visible?
It's coming. Visible.
Yeah. Okay. So today we are going to discuss about thyroid disorders and its homeopathic treatment. So as we all know, in our day-to-day clinical practice, we get a lot of cases of thyroid disorders, maybe like hypothyroidism, hyperthyroidism, women coming with irregular menstrual cycle. So these kind of symptoms will be there when that person will be having thyroid problems. So we all know that thyroid, it is a gland which is situated in front of the neck. It is having a shape of butterfly. You can see in the picture. So thyroid gland, it is a gland which is necessary to for every human body, as it produces thyroid hormones. So we all know that the thyroid hormones are TSH, that is thyroid stimulating hormones, T3 hormones, T4 hormones. So these are the hormones which are produced by the thyroid gland. So thyroid gland, it regulates the digestion in the body, metabolism, the overall health of the body, like mental, lungs, stomach, kidneys, everything. Overall, the thyroid gland regulates the whole body. So when this thyroid hormone secretion decreases or increases, there are certain conditions which comes to the human body. So thyroid problems are a prevalent medical condition that can affect many aspects of well-being. So these the thyroid hormones, when it is increased or decreased, the causes are lifestyle and dietary irregularities. When any person who takes irregular diet and when he doesn't have a proper lifestyle, like for example, sleeping late night or waking in the night time and sleeping in the daytime, when he is not exposed to sunlight. So these are the irregular food habits and irregular lifestyles. No exercises, drinking more of alcohol, smoking, or any other diseases causes thyroid problems in human body. The causes, signs, and available treatments are examined in this guide, including homeopathic approaches. There is allopathic treatment also, Ayurvedic treatment also. So many medical approaches are there. But for thyroid problems, homeopathy approach is very good and it brings the result very soon. So along with homeopathic medicine, we advise lifestyle management and dietary changes for thyroid health. So what are the causes of thyroid disorders? So the first one is the autoimmune factors. Conditions like Hashimoto's thyroiditis and Graves' disease occur when the thyroid gland is mistakenly attacked by the immune system, which causes a breakdown. So when the autoimmune disorder is there in the human body, we see Hashimoto's thyroiditis and Graves' disease. In this condition, we see a person with loss of weight and his eyes are protrude. So when the immune system is attacked, and it causes which causes a breakdown. So this is one of the condition for thyroid disorders, that is the autoimmune factors. The second one is the environmental factors. When there is, I have already told, when there is irregular food habits, irregular lifestyle, and there is more of a radiation exposure, certain medications like lithium and iodine deficiency. Iodine deficiency means when a person takes salt which is which is uniodized. So we have to bring awareness in the community for everyone to buy iodized salt. Okay, when the salt packet is open, we need to advise them. When it is open, when the packet is open, we need to bring awareness in the community that it has to be stored properly in a glass jar, airtight container. Because when it is openly kept, or if it is kept in sunlight, the iodine is vaporized. So when that person takes the salt which has less iodine content in that, it causes iodine deficiency. That is the goiter. So goiter, we all know that the goiter means the person whose inflammation in the neck is seen. Okay, inflammation of the neck is seen. So goiter, there are many types of goiter in that. Toxic goiter, non-toxic goiter, nodular goiter, multinodular goiter means when the nodules are present, which becomes multinodules, means the in the nodules when pus accumulation is there, that becomes multinodular. So diffuse goiter is also there, means swelling will be there, and it accumulates with pus inside, and there will be pain in that. So these are the types of goiter which is caused by iodine deficiency. The another condition is genetic predisposition. When there is a family history plays a crucial role in the likelihood of developing thyroid disease. If thyroid disorders run in the family, the other person in the family is at the higher risk. So you can see in the picture differentiation between hypothyroidism and hyperthyroidism. In hypothyroidism, there will be hair loss. Okay, in hypothyroidism, hair loss will be there. In hyperthyroidism, the hair becomes fine and brittle hair in a woman. And in hypothyroidism, she feels fatigue. There will be like fatigue, weakness will be there. And in hyperthyroidism, there will be trouble in sleeping. In hypothyroidism, she has sensitivity to cold, means she gets cold very soon. In hyperthyroidism, there will be excessive sweating. In hypothyroidism, she faces constipation. In hypothyroidism, there will be weight loss. So these are the characteristic symptoms. And there will be increased cholesterol in the hypothyroidism. In hyperthyroidism, there will be high blood pressure. Weight gain will be there in hypothyroidism. In hyperthyroidism, there will be weight loss. So there will be dry skin in hypothyroidism, and there will be moist skin accompanied with anxiety will be there. Okay, so hypothyroidism is underactive thyroid. Means the TSH value will be more. It will be above 5. The normal range has to be between 3 to 5. In hypothyroidism, it will be above 5. Thyroid gland underproduces the thyroid stimulating hormone. TSH hormone is underproduced in the thyroid gland. In hyperthyroidism, it is overactive thyroid. Thyroid gland overproduces the thyroid stimulating hormones. Means T3, T4 is increased in hyperthyroidism. So this is the differentiating point between hypothyroidism and hyperthyroidism. So we all know that I have discussed hypothyroidism, there will be underactive thyroid. So in our day-to-day practice, many patients come to us saying that there is weakness and fatigue and there is weight gain. So there will be dry skin and hair. So we have seen that many patients without going to any doctor or any physician, they go to some medical shops, and for fatigue and weakness, they take some tablets. And if the skin is dry and the hair is falling, they take some like shampoos and other medicines which are available in the counters. So if there is cold intolerance and if they are getting cold frequently, they'll take some CPM tablets. So when there is depression and mood swings, they just ignore it. And when there is memory problems or mental fog also, they just ignore these type of conditions. We have to bring the awareness in the community, like if they feel anything of these symptoms. And main characteristic symptom in hypothyroidism is irregular menstrual cycle. So if they have irregular menstrual cycle, they just ignore, like next month it will come, or menstrual cycle, like that they will be ignoring the symptoms. But later on they come and to a doctor, and when they advise for a thyroid profile test, then it will be diagnosed. So we have to bring awareness in the community, like any symptoms they face, they need to come to a doctor and take the proper treatment and the proper blood test or the diagnostic criteria they have to undergo. So in hyperthyroidism also, the characteristic symptom, it is an overactive thyroid. The characteristic symptom is weight loss. Any patient which comes to a clinic, if that person says that there is sudden loss of weight, then we need to think of hyperthyroidism. And there will be rapid heartbeat and palpitation, excessive sweating, or heat intolerance will be there. There will be anxiety or irritability. There will be tremors, shaking of hands, and frequent bowel movements or diarrhea. So goiter and nodules, this is one of the commonest we see in our clinical practice, which is due to iodine deficiency. Neck swelling, goiter, or the appearance of lumps in the thyroid area. There will be difficulty in swallowing in thyroid, in goiter, and breathing if the goiter is large, if it is swollen more. Thyroid investigation and diagnosis, thyroid function test, blood tests including TSH, that is thyroid stimulating hormone. Free T3 and T4 levels are essential to access thyroid health. There is imaging, that is ultrasound is commonly used to examine the thyroid for enlargement or nodules that may indicate underlying problems. There is another test also, biopsy, that is fine needle aspiration, FNA. Biopsy is performed on thyroid nodules to determine whether they are malignant or benign. Complication and risk factors of thyroid disorders is in hypothyroidism. If left untreated, hypothyroidism can result in issues like weight gain, fatigue, depression, and cardiovascular issues. Enlargement of thyroid goiter nodules may require further investigation, mainly to rule out cancer. So traditional treatment for thyroid disorders, as we all know, the standard treatment for, they go to counters and take levothyroxine supplementation to replace thyroid hormones. In hyperthyroidism treatment, hypothyroid is regularly managed with antithyroid medications like metimazole, radioactive iodine treatment, or even surgical removal of the thyroid gland. Monitoring and adjustment. Regular thyroid function tests are essential for adjusting medication dosages and ensuring optimal thyroid health. So, what is the homeopathic approach to thyroid? So, as we all know, that homeopathy is a holistic approach that treats not only the illness but also the general well-being of the individual. Like cures like. This is our principle. The symptoms of the patient are taken into consideration when choosing medications, including mental state and physical condition, not just the symptoms of the disease. So we take a case as a whole, an individual person. We take mental symptoms prominently and the symptoms of the patient. So individualization is there in the homeopathic practice. So each person's symptoms are unique and homeopathic remedies are chosen based on the health rather than just focusing on thyroid dysfunction. Miasmatic analysis is very important. Homeopaths may assess miasms, inherited tendencies, to understand and address more profound cause of thyroid dysfunction. Potency and dosage, depending on the sensitivity and responsiveness of the patient, homeopathic remedies are recommended in a range of potencies and dosages. Homeopathic remedies for thyroid health and their uses. The very important and very commonly we see in patients is the Calcarea carbonica, often often prescribed for individuals with a sluggish metabolism. The person will be fat, fair. It is particularly useful for people who experience fatigue, cold intolerance, and excessive weight gain due to an underactive thyroid. So I'll discuss one of the case which I have received in my practice. A woman of a peculiar Calcarea carbonica only. She was fair, fat, and she had hair loss, and she increased the weight uh, in a in a very little span of time, and she had a frequent cold attacks was there, and there was irregular menstrual cycle, and there was lots of acne on her face, and she was very depressive. And when we take the case, we have to take it as a person as a whole. The peculiar symptom in Calcarea carbonica is she was fond of eating raw rice, and chocolates. And this is the particular symptom. When I was taking the case, when I was asking like what is her desires, aversions, uh, so this symptom got the remedy. And when Calcarea carbonica was given, in the next follow-up, lots of symptoms came down. So in homeopathy, we need to take the rare symptoms, peculiar symptoms. So case taking is very important. The next remedy is the lycopodium, recommended for individuals who suffer from thyroid-related digestive issues and anxiety. So these persons will be having digestive problems. People who need lycopodium may experience bloating, gas, and acid reflux, along with nervousness or self-doubt. So lycopodium is very important with persons having digestive issues along with thyroid problems. Sepia is very important individualistic remedy used for hormonal imbalances. Particularly in women, it is helpful for those who experience irregular menstrual cycles, mood swings, and exhaustion due to thyroid function. Sepia also, in my practice, this patient had come with an irregular menstrual cycle. When case taking was there, her she was sitting with her both legs closed. So this is one peculiar symptom of sepia. So based on that, when we give that remedy, uh, she was recovering very soon. And another very important common remedy is thyroidinum, a general homeopathic remedy used to support overall thyroid function. It may help balance thyroid hormone levels and elevate symptoms such as fatigue, weight, fluctuations, and mental fog. So, thyroid, we see in lots of cases in our day to day practice. So, we need to convince them, we need to, along with homeopathic remedy, we need to advise them dietary irregularities. The person who are having dietary irregularities, we should advise them to take home food, not to eat outside food, or junk food must be avoided. If that person is taking alcohol, smoking and all, we need to advise them to stop it. They need to do some meditation, yoga, running, walking, so that the hormonal imbalance is maintained. And home cooked food with lots of vegetables, fruits, green leafy vegetables, pulses has to be taken, so that the dietary lifestyle is maintained. And we should advise them to take 8 hours of sleep in the night time. And we need to advise them to get up early, do some walking exercises, then have breakfast, lunch, evening and night, evening snacks and night dinner, and drink 4 liters of water, 4 to 5 liters of water in a day. So these dietary lifestyle changes can help the person to, along with homeopathic remedies, to beat the thyroid problems and lead their life successfully. Thank you. Okay. Any doubts you can ask me, or shall I share one more
Yes,
case?
yes, it's everything fine. You can go ahead with the presentation.
Yeah.
One
Okay.
more.
Yeah. Okay. Uh, Actually, in my clinical practice, I have seen one more case with Natrum muraticum. The person was weak, slim, tall, oily skin was there, and she was having this thyroid problem, that is of hyperthyroidism. When we took the case, when she came to my clinic, I just saw that she was very depressed, and she was having a headache in the morning 10 to 11 a.m. and she was fond of salty food. Oily skin was there, and there was irregular menstrual cycle, and she was very depressed. So when she came to me, when I was taking when I was taking the case, she was saying that she was very much depressed, crying, moody. One time she's good, mentally she's good, and another time she's like very intolerant kind. And she was having headache from 10 to 11 a.m. That is one peculiar symptoms. And she was having craving for salty food. And her TSH value was 7. Mm. So when Natrum muraticum remedy was given in the dosage of 200 for 4 days, followed by Saclac for 15 days, and in the next follow-up, in the next month, her she responded to Natrum. So when we are taking the case, it's very important to take the rare peculiar symptoms. We need to examine the patient. We need to observe the patient, and based on the mental symptoms only, when the and doing repertorization of the case, we find a peculiar, rare, individual remedy. When it is given in the potency of 200, the patient feels better. The dosage is 4 pills 3 times a day for 4 days, followed by saclac. Uh, when this dosage is given, the patient will start improving with homeopathic medicine. Okay. Any doubts you can ask me? Any questions? See, I was saying, no, like yeah, the last remedy is thyroidinum. Thyroidinum is the most commonest remedy. So, as the name thyroidinum. So, there are many individual remedies also, like sepia, lycopodium, calcarea carbonicum, natrum muraticum. But thyroidinum 6,6, when it is given, it will help the patient to combat the thyroid. To combat the thyroid problems. So we see many patients taking levothyroxine, allopathy medicine with no improvement. uh, they come to us saying like from 6 months, such cases have come to me. From 6 months they are taking thyroxine 30 mg, 50 mg, sorry, 20 mg and 50 mg, and TSH value is the same. It has not decreased, but it has increased. They changed the dosage also from 25 mg to 50 mg, 75 mg, 100 mg, but there was no use. So when they came to us, like with no improvement in other system of medicine, and when we take the case and when we give a particular remedy, like individualizing, when we find out the rare individual peculiar symptoms, and when we give the remedy, within 15 days the patient will show the results. So it's very important in homeopathy to take the case properly and to find out the peculiar rare individual characteristic symptom. So that is very important in our practice. Any doubts? Any doubts you can ask me. So thyroid is very important because in our day-to-day practice, in our busy schedule, like uh, everyone are in their work, and they are in their lifestyle of working and very committed in their work. But it's very important, like they need to come to a doctor and show with any thyroid symptoms. So we need to build a rapport with the patient, and give them proper medicine so that we can treat the patient. So another yeah, the dosage is 200. For example, calcarea carbonicum 200 TID for 4 days, followed by saclac. Okay. Uh, I'll discuss about another case. There was one patient who came with the symptoms of mental symptoms was more. There was fear, and there was loquacity, like talking more, and there was hair fall, and there was increased appetite. And when thyroid test was done, that person was having hypothyroidism. She was having hypothyroidism, and there was irregular menstrual cycle and delayed menses. There was weakness during menses, and she feels better in cold air. Hot thermal reaction was there, and there was profuse perspiration. After analysis and evaluation of the case, like in mind, fear was there, misfortune was there, and in mind, loquacity was there, and head hair falling, and stomach appetite increased, and external throat, thyroid gland, and in female genitals, menses irregular. This is the repetization points, and in general, weakness was there during menses. So in amelioration by cold air, and heat sensation was there, and there was profuse perspiration. So after repetization, in materia medica, iodine was selected. The potency was iodine 30C twice a day for 5 days and followed by placebo. This is one iodine. Iodine was on repetization. Iodine was selected. The patient was medium built and 53 kg body weight was there, and BMI was 21, and her blood pressure was 110/60. Pulse rate was 79, and her respiratory rate was 16. So there was no pallor or cyanosis or clumping. Okay. On palpation, the thyroid gland was mobile, firm, and non-tender. Based on the women was very loquacious, means talking more. She was observed to be quiet and anxious. She had also constant fear that something would happen. So these are the characteristic symptoms, and when repetization was done, iodine 30 was given. The patient presented with complaints of menstrual irregularities, hair fall, which were common symptoms of hypothyroidism. However, weakness during menses, fear of misfortune, and loquacity were characteristic symptoms in this case. Furthermore, hypothyroidism usually presents with intolerance to cold, loss of appetite, and weight gain, whereas in the case there was amelioration from cold air. Increased appetite and no weight gain was there, which was peculiar in materia medica. Based on this peculiar characteristic symptom, iodine 30 was selected. 30C twice a day for 5 days, followed by sac-like. Was given, and she responded to the remedy. Okay. Okay, another cases.
Yes, we have time. Another case can be presented.
Okay. Thank you, sir. Okay. Like other remedies for homeopathic in materia medica is spongia tosta. So there will be enlarged thyroid gland will be there with a dry barking cough. So in this, there will be a dry barking cough. Patient feels suffocated during sleep. It gets worse before midnight. The patient with hyperthyroidism, when the patient has got enlarged thyroid with a dry barking cough, patient feels suffocated during sleep. It gets worse it gets worse before midnight. Sir, what is TG? The triglycerides. Okay. In iodine, there is intense hunger and weight loss. The case which I presented, high irritability, rapid metabolism suited to hot, restless individuals. In natramure, thyroid swelling, hair loss will be there, heat sensitivity, emotional suppression, grief or sadness. Natramure is given. In phosphorus, there will be heat intolerance, anxiety, trembling, and sensitivity to odors, noise. The patient craves cold drinks. Phosphorus case once had come to my practice. The patient was lean and thin. He was slim. He was having a cold frequently, and he was very anxiety was there, and trembling is there, and he wanted to be alone, and there was sensitivity to odors and noise, and he was craving for cold drinks. Okay. And when the phosphorus was given, the patient responded uh, to the remedy. Sepia means hormonal imbalance with irritability, fatigue, and indifferent attitude towards loved ones, suited to women with menstrual irregularities. Okay. Like another, homeopathy is a very good, important uh, homeopathy. In homeopathy, we treat patient as a whole. Okay, one more case I'll be discussing. 1 second. One second. See, there are lots of okay. Okay. This is a case. Um, okay. The patient. This is also a case of calcarea cup. The patient aged around 36 years with irregular menstrual cycle. She was fat and flabby, fair. She was having irregular menstrual cycle. She was very depressed, and she started gaining weight uh, in a very short period of time. And there was there was a dry skin, and she used to get frequent cold. She used to not sleep properly, and appetite, like she was having like craving for food, and suddenly she started gaining weight. Hair loss was there, and for hair loss she had taken many treatment outside. And irregular menstrual cycle, she was taking some herbal medicine which didn't help for her. There was there was a sudden loss of hair for her, and when she came to me, and she had undergone USG abdomen scanning, and it was normal, and it was showing PCOD. Other conditions were normal. It was showing a PCOD, but she didn't go for any thyroid test. So this was the case which came to me, and based on these clinical symptoms and the examination of the patient, uh, there was no pallor. When I advised for thyroid test, her TSH was 8.3. So based on this, and she was craving for chalk piece. She used to keep chalk piece in her bag and eat it. So this was one craving for her. And based on this, when calcarea carb 30C was given, BD for 5 days, followed by Saclac. And she responded to the remedy very well. She was that when she came for next follow-up in the next month, she was feeling better, and uh, she responded very good uh, for the treatment. Yes, sir.
can go ahead with your
Sir,
present-
sorry.
Yes, you can go ahead with your presentation, no problem.
Yeah, okay. Yeah. So this was the case which I received. So any doubts you can ask. Sir, you had asked some question regarding
Yes, there are some questions in the chat box. So let's see. Increased TG-TPO cases, what medicines to give? And it thyroglobulin,
thyroid peroxide. Sir, I think thyroidinum can be given. Thyroidinum 6,6.
somebody was asking for potency and dosage. Yes, anyway, congratulations, Dr. Shalini, coming over here and delivering a very good speech on thyroid disorders. And as we know, that thyroid factors is one of the thyroid diseases are quite common with people. People have a belief that in the early history, we used to say that this is more prominent in the hilly regions, but things are entirely different now. We can find thyroid disorders even in the coastal area, because I'm residing in a coastal belt of Kerala, and we have a lot of number of cases are coming with the thyroid problem, because we can see that at least 10 out of 1 can be a thyroid case when we get in our day-to-day practice in chronic diseases. But there are the fact is that we in the early part we used to say that it is because of lack of scarcity of iodine that produces this disorder, but actually it is not. What we find that most of while we take the case in details, what we find is that most of the patients are suffering from mental, either mental stress or some kind of problem, or some kind of conflicts or whatever maybe. The mental issue is the most important, prominent cause for these disorders. But unfortunately, still the modern people used to say that it is because of this scarcity, and they have distributed the so-called iodized salt to all people. But the thing is that it is directly proportional to the intake of this iodized salt. So that is not the solution at all. So actually, what we need is to, as a homeopath, we will have to look into the case in a detailed way, as you just suggested, and find out what are the reasons behind the cause of illness and how it affects, and the prominence, whether it is producing any symptoms or symptomless. There are cases where we can see that there is no, not even a single symptom for a patient, but it may be an increased TSH level, or at times it can be an and enlarged thyroid gland, but then patient may not be suffering any disorder, any problem at all. Actually, when we I still remember a case of thyroid where the patient was actually, she was not a person above 45, and visited to the clinic just as the grandmother of the child with her son-in-law and the child. Then on observation, I just asked her, your neck has, do you feel any problem with your neck? It seemed to be a thyroid disorder with you. Kindly check it. And then she told me, doctor, why should I check? Because I have to take care of all these things. And then I only thing I can do is I can ignore my problems. That's what she told me. But on then I just asked the son-in-law to take her to the lab and investigate the case, the thyroid function test, as well as the CT scan of neck. What we find was that it was about 100 and above. the TSH level was so much high. And when further inquiry, she told me that, doctor, I used to have suffocation during sleep. I used to get up from sleep for 3 to 4 times or five times a day. But I didn't mention the same to anyone. But after taking the case, I found that it is because of the conflict that's going on in her family. She is always taking care of all these things, but she has intense heat in her body. As we know that it is the time of 45, the age of 45, and is nearing to the menopause. So it can be a symptom of menopausal syndrome also. She is very hot, and the problem is more aggravated during night. And so that's the reason why I just give her a laxative to the patient. And along with that, I just give her thyroid 3x also, because it was too high. The level was too high, along with the calcarea floor also, because that can also give some kind of reduction to the gland itself. Actually, what happened that after further investigations, every 2 or 3 months, we used to check her TSH, and it gradually come to 80, 60, then 40, then all of a sudden it come back to 20, and then after some about 1.5 years of treatment, it was just 2.5. All the evidence were there with my laptop, and I used to share in some of my presentations. And what happened was that I just asked the patient to stop all medication thereafter, and she didn't take any medicine at all. And after some 2 years later, when she came up with some fever, I just asked her to recheck everything, because to confirm that there is no problem with the lady. And what the finding was exemplary, interesting, because it was just 1.3. So even after stopping the medicine for 2 years, the thyroid TSH level didn't rise. That's the beauty of homeopathy. That's how we can manage these kind of thyroid disorders. That's a very interesting case, and that means that it is not only sepia, ignitia, natrum, or whatever be the medicine, the similimum will work at all times and at every times. That's the beauty of homeopathy. That's what we can say also. So everyone need to find whatever be the thyroid toxicity, whatever may be the thyroid problem. You just bother about the name of the disease. You just concentrate on the patient symptoms. What the patient is presenting in front of you. That's what you have to look into, and then you will definitely get the right simillimum, and you just go on with that. You can find the case will be cured. So many thyroid case successful stories can be tell in that way also. Anyway, those who want to participate in the discussion may raise your hand, so that we can allow you to unmute yourself, and we can talk to our guest, Dr. Shalini. She is practicing in Bangalore, and having she is very much interested in chronic diseases and chronic cases. And she's having very good experience in managing all these things. Yeah, doctor, what is the present situation in your place? Whether the thyroid disorders are increased on the rise, or whether you are getting
Sir, it's not like increased or decreased, but we are getting the case.
yes,
Hypothyroidism.
yes, yes. We, we will get all kind of, not only hypothyroidism, hyperthyroidism,
Yeah.
thyroid,
Goiter.
thyroid infections, just like
Mm.
thyroiditis. All those things can
Yeah.
be there, and managing all those things in a better way. It doesn't matter that any specific medicine can be given into hypothyroidism or hyperthyroidism. There is no such a differentiation in homeopathy. Am I right?
Yes, sir. But
Yes.
more of hypothyroidism cases.
Yes, yes. As you know, that's common. That's everywhere. Hyperthyroidism is comparatively less. But in the early days, people used to get this hyperthyroidism because they may come up with the goiter and everything. But the goiter cases are comparatively less when compared to the hypothyroidism cases. Even children, we can find it in newborn babies also, because then the mother may having this problem, then they may have this thyroid problem. That's the reason why nowadays the pediatricians used to check the thyroid function test in every child to make sure that the thyroid disorders are not there. And we know that some of the young children also used to take these medicines, and when they come up with the homeopathy, we can gradually stop the allopathic medicine and we can go. And how will you manage a case when it come with the patient used to say that we used to take these thyroxine 225, 50 or 200. How will you manage? Whether you directly withdraw or whether you allow the patient to continue with the same medicine along with the homeopathy, or then
Sir, I advise like let them continue the allopathic medicine along with that homeopathic medicine. Because yeah,
that's the right method. We will have to allow, but actually, when a patient come with, for example, a person who used to take some 200 milligrams of thyroxine, I just ask them to reduce it to 150 or 175 along with homeopathy, and gradually to 150, then 125 to 100, like that. Then we need to observe also what are the changes happening. But a patient, if come to a homeopathy directly, we will get a good result rather than a person who is coming after getting allopathic treatment.
yeah, yes.
Yes. As I'm inviting Dr. Bob to say, Bob Lim from Malaysia, you can say something more on that. Yeah, what's your experience with the thyroid disorders in Malaysia?
Yeah, sorry, I'm in my car now. You can see me.
Okay.
Can you hear me?
Yes, yes, yes. We
Yeah,
can hear you. We can hear you as well as
yeah,
we can see you.
yeah. In Malaysia, those patients with terrorism, they don't usually seek homeopathic treatment. They usually goes on the conventional treatment, and we have very few cases, but sometimes we use according to the symptom, and most of the cases we are using Kalkaraka, we are using iodome, and all this, yeah, and thyroidinum. There's a few remedies which he has prescribed, and also lycopodium. So, and like she says, we have to, like you, Dr. Dade says, and our Dr. Shani says, that we have to prescribe according to the presenting symptom, and that is true. And we
Okay,
have to
you can.
individualize it in order to have a good result.
Yes,
And
you can.
let us say thank you very much to Dr. Shahini for giving us a very good discussion on terrorism. Uh, we hope to have you present some slides on your patients in the slide form, and that would be better for us to follow. And because the voice might not be very clear just now, and on top of that, we are very appreciative of your sharing tonight, and thank you very much. It was a very good discussion. I think Dr. Danesh also have put in some information too for us. Thank you very much. And over to you, Dr. Danesh.
Thank you, Dr. Bogli. Dr. Shalini, do you want to say anything more?
Nathan, thank you so much for giving me an opportunity to present on thyroid disorders and its homeopathic treatment. Thank you so much.
Thank you, Dr. Shalini, and those who attend the session this evening. Tomorrow we will have a presentation from another person. Hope all of you will join at the meeting tomorrow at the same time. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.